But hello, everyone. This is Dr. Anmig, your friendly rheumatologist. Thank you so much for tuning in into the UnabridgedMD podcast. As you have probably noticed, the UnabridgedMD podcast is going a little bit more towards a rheumatology focused podcast, and I'm bringing a little bit more the Rheumatology 101 lives in there. The idea is just that, I'm catering more for rheumatology patients. However, this is always ever changing. And I really wanted to continue the podcast because I think it's really valuable and very important. I'm going to ask you guys to let me know what topics you want me to discuss. I also will continue to bring on guests, and that's where we're going to see any guest interview and so on. But what do you want to talk about? And today, I'm going to talk about ways to save in the healthcare system in the US. So I think everyone wants to listen to this, even if you don't have any needs right now, which I'm really hoping you do not. But you wanna listen to this because it's literally a question that keeps coming back over and over. And sometimes it's not a question, but it's actually an important topic that I have to discuss with my patients. And so, without further ado, what are we going to learn? We're going to learn how to save money by choosing the right insurance for you. We're going to learn how to save money by, how to decrease the cost linked to drugs, and then prevention, and then other little hacks. Okay, so you want to listen to this. If you find this interesting, please share it. And also, don't hesitate to write replay if you're listening to this on YouTube. Without further ado, let's talk about this. Okay, so this is actually going to be hopefully you're going to get something out of it that you can actually implement. I'm going to start first with how to choose an insurance. Okay, so the reason I have delved into this is that I'm French. In France, we have one system. You can get a complimentary, but basically most of us just had one health insurance paid for by the government. Basically, you're paying from your income tax, you're putting money into this, big bucket, and then that comes back to you if you need it, right? And that's how physicians are paid. And then I've come to the US, and I'm like, what the heck? What is this? And then I'm getting this choice of 5 different plans, and I was like, I don't know how to choose this. How do you choose, right? And then you're like, high deductible, low deductible, max out of pocket. And you're like, what does all of this mean? And here is how I tell everyone to choose. So, but I'm gonna make a little thing here, because there is a very easy way to choose if you have a chronic condition where you're going to need a biologic or something, right? So if you're a user of healthcare, there's a very good way to choose. And if you're not a user of healthcare, there's another type of way to use. I'm going to go ahead and get out of the way you're not a very high user of healthcare, because I want to take this away because you're probably not a rheumatology patient. You might be, but if you never ever go to the doctor, you're probably thinking, I don't need healthcare. I think that's a mistake, because you don't want to have to think about health. Health is something that you should never have to think about money. I really mean it. You think about it at the beginning of the year, but then you don't think about it, or the beginning of whenever you have to choose your plan. So what you want to do if you don't ever take, medicine, is you want to have, in case of emergency type of care, right? I think it's called emergency plan. You want to have at least that, because let's say you break you're a rock climber, you break something. Hopefully you never have to break anything. Then you want to take care of it. And the problem is that the moment you go to the ER, it's going to cost so much money that you don't want to have to deal with this. And the worst thing for me is to literally see patients not actually take care of themselves because they don't have health insurance. So please, 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 if you're someone that doesn't use healthcare, have an emergency plan, okay? And then the other thing is that if you're a student, you can get Medicaid, highly recommended. If you don't have enough money, like make sure that you have Medicaid, or if you're over 65, Medicare. But like even like those plans for Medicare are so expensive as well, right? Okay, now we've put those away. You're probably not, you're probably some patients that are seeing me, but or seeing people like me are listening to the podcast, but probably the people who are listening to the podcast, you guys have, maybe a rheumatologic disorder or something like that. So if you have a rheumatologic disorder, or if you're planning to be pregnant, you want a good health care insurance. And the way to compare those insurance, I'm going to be actually super blunt here. To me, you want to imagine that you're hitting your max out of pocket. The vast majority of time, those max out of pocket are about like $7,000 if it's a high deductible plan. But the truth is that you wanna really like imagine the worst, and then you wanna take care of that, right? Okay, so now let's talk about the people who have needs for healthcare that know, for example, that they are going to need medications that are costing some money, or that they are pregnant, or that they want to be pregnant. Patients who are actually going to need more of a healthcare, right? What you're going to do is you have to basically to compare apples with apples. What are we doing? You're going to look at all of the plans. I'm putting them in column, right? You're going to look at all of the plans. You're going to add the max out of pocket of each of those plans, and you're going to add the monthly premium. So let's say every month it costs $400. You put $400 times 12 plus the max out of pocket, and then you're putting under how much it costs in total. And you do that for every single of the plan that are offered to you. Either it's because they are offered to you through the marketplace, or because you're getting that offered by your employer. You're looking at that. The other thing you need to do, this is a scoop, marketplace may not be the right place for you. I took my own, I bought my own healthcare, and I realized that it was way cheaper if I were to go directly to each insurance. So I went to Cigna, I went to Kaiser, I went to, I don't know, like all of those, like United Healthcare. You look at how much all of those plans cost if you get directly to them, okay? So that's another clue. And again, what I did is that I'm looking, what's the max out of pocket and what's the monthly premium? And then you finally can compare apple to apple. How much does it cost with each of those plans a full year of care, considering that you most likely will hit that out of pocket? Don't worry, I've got some ideas about the out of pocket, okay? All right, so you're looking at this and then you're choosing. From now on, normally, the really cool news is that you're able to compare those plans, okay? So that's number one. Or number two, I can't remember. Now, once you have this healthcare, right? Like you could also decide, I'm someone that doesn't really use much healthcare, so I'm going to do in case of emergency plan, and then I'm going to decide that I'm going to do direct care with a primary care physician. Usually, if you're doing primary care physicians plan, it might be between, I think in Denver, like it's around 80 to 150 per month. And right, like you just put it, like how much does it cost to do that? You know that the blood work is going to be lower. You know that the medications, we have deals, with medication. I'll talk to you about that, right? Same thing with rheumatology. If the only care you need is a rheumatology need, you might, say, okay, well, I know that I'm doing really well with a drug that doesn't cost much money. I would rather just seeing, let's say that Dr. Amig, and then I'm going to just have this in case of emergency plan. You can do that, right? Okay. But you choose thanks to this because you're choosing by really realizing, like, how much does it cost for me to have healthcare and good healthcare for the year, and how can I compare them, okay? Now, there are ways to decrease cost of medicine. So one of the things that you have to realize that the insurance is it's a game. You've got to consider it as a game, because otherwise you're going to be frustrated. So it's better to see it as a game. So see it as a game. What that game is to basically know that they jack up the price, all right? And that their whole game is to basically try to prove to you that thanks to them, you're getting a good price. And so they're going to try to show you that the cost of a doctor, the cost of drugs are very high. And thanks to them, you're only paying the copay, right? Okay. So if you have, so here's the thing. If you have a condition like rheumatoid arthritis and you're in a biologic, my recommendation to you is to talk to the biologic drug company and ask them if they have a patient assistance program. And that is the first thing you're going to get at the beginning of the year, because in Colorado, most of the time, you can get the patient assistance program to pay for the drug, and that can be considered as part of the maximum out of pocket. So for example, I'm still on a biologic actually, technically. So I'm on a biologic. And basically, so that's, prevention of cancer and all this, right? Costs a lot of money, because those biologic are really good. We're okay. Like, it's not, I don't think big pharma is a problem. I'm very grateful for big pharma, because they make drugs that are life-saving, or quality of life-saving, right? And they need to be paid, and that money goes into research and development. I'm much more upset at the healthcare system, insurance company, because their whole goal is to make money out of our health. That I'm upset. So what you can do, in my example, I would get the drug first of the year, and the drug company would pay for the copay, right? And so then my healthcare was, basically not free, because you're still paying the premium, but I hardly paid anything because it was part of the copay. So you do that at the beginning of the year. You don't schedule a surgery, you don't schedule an colonoscopy, you schedule your medicine if it is a biologic, okay? You schedule the high-cost medicine at the beginning of the year, so that the patient's assistance program, copay program, can help you pay that maximum out of pocket. Once you've done this, you've hit the maximum out of pocket, then you're just paying the premium. That's it, all right? So that's the first hack of the system. The second is, if you're someone that's only on a very basic medicine, basic doesn't mean bad, like they're very good. So let's say you're on methotrexate or plaquenil, hydroxychloroquine, or any of those drugs that don't cost a lot of money. Then you know that maybe you don't need a lot of healthcare needs. And so what you could do is that you may realize that actually it costs more money to do the copay of those drugs with insurance, rather than going directly to GoodRx. So you can get a coupon with GoodRx, or you can use a Mark Cuban pharmacy. So those pharmacies are American. They all, pay FDA approved and all this, but it's giving you a coupon, and it's kind of crazy. Sometimes you go to your pharmacy and you realize that if you use that coupon, your drugs are, like, I want to say 90% less expensive than if you were to use insurance. So yes, it doesn't go through your deductible, but again, you might actually never hit the deductible. And that's the thing that is so frustrating with healthcare, is that you kind of have to have this idea of, like, for me, sometimes I'm just like, no, it costs so little to pay for plaquenil or to pay for, some of those drugs, that's what I'm going to do. I'm not going to go and, pay the copay of this. Like, I don't want to have to deal with this. Okay, so that's the second hack. Third hack is, if you are on a biologic, make sure, or any drugs that are a little bit on the expensive side, make sure you look at patients' assistance program. They have so many, because you have to realize they make money if you stay on those drugs. So they might offer you some free samples. They might offer you, like if you're going from one insurance to another, they might give you some medications in between, and they might help you pay for copay. And so you have to know if they have any sort of program, and you want to really make sure. In my practice at UnabridgedMD, we work with those programs and we make sure that our patients are linked to them because we know that it can really save a ton of money. I've had patients who told me that my fee was basically paid for from the moment I had put them in contact with those patient assistance program that they didn't know for years with their previous rheumatologist. Again, because it's so busy in the preview, like the other insurance-based model, that they don't have the time to help you with that, which is bad. The other main thing I'm just gonna have to say is that prevention is key. It actually costs more money to not take care of you. Take care of you. This is just PSA, public service announcement. Make sure that you're taking care of you, that you're sleeping as well as you can, that you're exercising regularly, that you surround yourself with love, that you're meditating, that you're doing everything that you need to do from a prevention perspective. This is actually taken care of. Like if you're 45, make sure you have, or above, make sure that you have had your colonoscopy. That is a prevention tool, and so that shouldn't cost you any money. You make sure that you say that this is preventive, right? Go and get your vaccine if there's no contraindications and things like that, right? Take care of you. This is important. Use the wellness program that your employers have, because that's also super helpful, okay? So that's that. There are other hacks. You can use the HSA to pay any bills, like to get to your max out of pocket, payment. So personally, I've realized that I hit my max out of pocket all the time. And I've realized that for me, it's always a high deductible plan that's going to be worth it for me. And so that's what I go for. And I get an HSA, and the HSA allows me to pay for any sort of needs that I have in my healthcare. And so it's 30% less because, right, like it's pre-HSA is before tax. And the thing is that if 1 year I don't use my HSA, it goes for the next year. And you can actually put that money, and I think there are some people who put that money and make it work, in stock and finances. I don't know how to do that. But that's something we say that it's triple tax benefit or something like that, because you don't pay taxes on whatever money you made from the HSA account. So, just another hack. So just, look into that, the FSA, HSA. I like HSA personally better because the FSA, you have to use it. The HSA, you don't have to use it. So if 1 year you're not using it, you have the money for the next year, okay? And so on. But yeah, so basically, this is the French person telling you what she's learned about the healthcare system in the US. Hopefully those hacks have helped you. They are helping you. If you have questions, don't hesitate. You can actually go on the YouTube channel and just put some comments out there and then ask me. I'll be able to help you as much as I can. But really, 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 there are hacks into the healthcare. Don't ever pay a bill from the hospital without talking with them, because they can decrease the price. It is kind of crazy to think that we have to deal with that, but we do have to deal with that. And there's a lot of ways to decrease the cost. Hopefully this has been helpful to you. And yeah, make sure that you say replay if you're watching this. And then if you can write a review on the Apple or whatever podcast platform you use, that would be wonderful. And I will see you next time. Take care. Bye-bye.